Dr. Laura Miller. I'm a neurologist with the Inova Health System. I'm a headache medicine specialist, and I'm the co-director of our headache program. June is Headache and Migraine Awareness Month, and in honor of that, I wanted to provide a little bit of information about headaches and when it's important to seek care for headaches from a doctor. Now, nearly everyone has a headache at some point in their life. After all, it's the second most common neurological problem after neck pain. And most of the time, most headaches are not caused by something serious. In fact, the most common headache triggers are things like not getting enough sleep, being dehydrated, and skipping or missing meals. But very rarely a headache can be a sign of something more serious. So there's certain situations where we would want you to seek emergency care for headache symptoms. So when should you seek emergency care for a headache? One situation would be if it's the worst headache of your life. This is something that you've never experienced before and is a pain level that is just off the charts for you. The second would be if the headache's associated with things like fevers, neck stiffness, confusion, anything that might be a concern for an infection going on. The third would be if you're experiencing anything that could be a stroke-like symptom. Examples of that would include loss of vision, droop of the face, weakness of an arm or a leg, or if you develop numbness and tingling on one side. And then the last situation would be if you have something we call thunderclap headache. So this would be a headache that kind of comes on, boom, all of a sudden, is super severe in a split second, as opposed to something that kind of builds up gradually over the course of minutes to hours. Again, for all of those situations, we would recommend that you seek emergency care. Now, there are other times when emergency care is maybe not necessary, but it is still a good idea to talk to your doctor about your headaches. So examples of that would be if you're someone who's over the age of 50, you're not usually a headachy person and you start to develop headaches. If you are someone who has headaches, but your headaches are changing, they're either becoming way more frequent or way more severe, or they're no longer responding to the medications that you typically use to treat them. Another situation would be if your headaches are waking you up for sleep, and if you're someone who has a history of cancer, HIV, or other immune system problems, these are all times where it's a good idea to see your doctor for an evaluation. Now, in terms of what type of doctor to see, if your headaches are rare and infrequent and usually mild to moderate, you would want to start off with seeing your primary care physician. Sometimes they will decide to refer you to a neurologist if your headaches are becoming more frequent and harder to manage. And then a headache specialist is typically recommended if the headaches are very frequent to the point that they're disabling, or if you're someone who has a really complicated medical history with lots of other medical problems or medications that would need to be taken into account. I really thank you for joining me today. I hope that this information was useful for you. If you have any other questions, I'd love to refer you to our website, which is www.inova.org/neuro.